Good afternoon, and thank you for joining us for our weekly update. Today I am joined by Dr. Lawrence Lowe, who is our Chief Medical Officer of Health here in the region of Peel, and Tim Beckett, our Fire Chief and Director of Emergency Management. I want to take a moment to briefly clarify reports in the media yesterday that Peel region saw an increase of 57 new daily cases. I know that Dr. Lowe will want to address this as well in more detail, but in fact we saw only 22 new cases in the region, and of those, only 4 of them were in Mississauga. This discrepancy was a result of our data system being migrated over to the province's new contact management tracing system. So rest assured, we're still in good shape and making significant progress here in the region and as a city. And on that note, Mississauga continues to see declining trends, with an average of 5 new daily cases reported in Mississauga over the past week. Today, Mississauga reported 7 of the 32 new cases in the region of Peel. We have been able to get a handle on community spread, which means we know where the virus is circulating, and we have been successful in tracing it. Trillium Health Partners have tested over 80,000 people in our community. And the situation in our senior settings has also come under control, with only 1 case active in a long-term care facility in Mississauga, and that is due to an active staff case. And while all this is very good news, we still have work to do as a region to drive our numbers down, so we can move to stage 3 in short order. Sometimes we forget how incredibly dense and populous Peel is, home to our 3 municipalities and over 1.4 million people. As you've heard me say before, this virus knows no borders. So when we move forward, we do it all together. I know the pandemic has been consuming, and many are frankly tired of it. We are seeing this not only in Peel, but across the province, especially with young adults. And by younger, I mean people under the 40 years of age, with new cases being a mix of workplace exposure and likely a bit of relaxing of the rules. So I know that this would provide you with all a few laughs, but please don't ask me to make my debut my dance moves on TikTok videos to get the message across to you Gen Xers, you Gen Zers, and all the millennials out there. I promise you I'm not as coordinated or don't have the dance moves as one of our local TikTok stars, Jagmeet Singh. On the note of moving forward, while Peel remains in stage 2 for now, I'm heartened by our progress and hopeful that we will be moving to stage 3 very soon. I want to thank Premier Ford and the province for allowing us to continue to take a cautious and regional approach. Throughout this entire crisis, the Premier has been listening to the needs of the big cities and the GTHA mayors and following the numbers closely. Stage 3 is not something we should take lightly, nor should we rush into it. We know when restrictions are loosened, we inevitably open up the risk for transmission. Stage 3 will see the reopening of virtually all businesses and public spaces. It will also increase indoor public gatherings significantly, from 10 to 50 in indoor public settings. And that includes bars, pubs, restaurants, etc. Something I know we're very much looking forward to, but something we also need to be very mindful about. We know that the virus thrives in those types of indoor settings where there's possibility of close physical contact in social settings, and when you mix alcohol into the equation, people lose some inhibitions and maybe aren't adhering to COVID-19 guidelines, will not be their top priority. That being said, I'm not trying to be a buzzkill, but in Peel, the mayors do have some concerns, and we are asking that the province explore some additional public health measures when it comes to reopening indoor spaces such as bars, restaurants, and indoor dining in pubs, and especially the clubs and the pubs. These recommendations include making sure that customers stay seated as much as possible, reducing occupancy limits to a maximum of 50 or less, depending on the establishment, to maximize physical distancing, requiring employees, in addition to customers, to wear face coverings, and making last call a little bit earlier than usual, screening all employees prior to their shifts, and instituting strict contact tracing measures. I want to give credit to Mayor John Tory and thank him for tabling these concerns earlier this week on behalf of the GTHA mayors. We have seen outbreaks linked to bars and restaurant reopenings here at home in cities such as Montreal, Edmonton, and Kelowna. And not to single out BC, who have been leaders in so many ways and arguably taught the rest of Canada how to flatten the curve, but they are experiencing an uptick in cases after Canada Day that have been linked to bars, restaurants, and private gatherings. It's easy to see how quickly we can lose the gains that we have made. We just want to be careful and not let our guard down as we approach this critical phase in our efforts to neutralize the virus. I don't want to let the thousands of bars and restaurant owners across this city to get disheartened by this. We all want to see you open, and we want to see you thrive once again. We just want to help you do it safely and responsibly. I also want to briefly touch on another growing concern of the big city GTHA mayors, and that's the reopening of gyms and fitness clubs, which, if not managed properly, could become breeding grounds for the virus. When you mix intensive physical activity in indoor settings, you run the risk of respiratory droplets spreading onto high-traffic touch points like gym equipment. So it is understandable why the mayors are so concerned, which is why the mayors of Peel, Mayor Brown, Mayor Thompson, and myself will be sharing Dr. Lowe's recommendation when it comes to additional measures the province could explore in Peel and other large urban areas to allow us to be even more cautious as we reopen these spaces in Phase 3. Before I provide an update on our latest council meeting, I want to take the opportunity to thank Premier Ford and Prime Minister Trudeau for landing a landmark $19 billion agreement last week that will help kickstart economic recovery right across the country. For those of you who have been tuning in weekly, you have, in all fairness, likely grown tired of hearing me talk about the growing deficits that cities like Mississauga face. This deal will see $7 billion flow to Ontario and recognize that COVID is not just a health crisis, it is an economic one as well, and will be felt for months and possibly years to come. I know that the ink isn't dry on the agreement yet, but I look forward to hearing how much of Ontario's $7 billion allocation will go towards helping the 444 municipalities cope with the losses that we have faced, the operational losses, the deficits we faced as a result of this pandemic. This money will need to flow quickly before we ink our budgets for 2020 and 2021. Despite these challenging times, we continue to conduct city business and keep Mississauga moving, hosting our 15th virtual council meeting today. Today at council, we first endorsed our economic and community recovery frameworks, which will give us the jumpstart we need to put our city in a better position than we were before the crisis. Our goal is to ensure that residents and businesses continue to have the supports they need and the ability to access networks and the resources they need to thrive. Working with our BIAs, community service organizations, youth and older adult groups, ratepayer and resident associations, our business community, and many, many more, we are actively working with our community to ensure that our recovery efforts will meet their needs and that change how we conduct business as a city to respond to the new normal. As part of our efforts to kickstart the recovery, we will be resuming our community recognition program as early as August 1st. This program will see hundreds of requests from community and cultural groups for flag raisings and clock tower lightings right here at City Hall each year. While small, this program means so much to so many right across Mississauga. It celebrates our diversity and showcases the causes that matter the most to our city, and we are thrilled to be welcoming it back. This is just one of the many ways we are building back to better right here in Mississauga. Secondly, we approved a revised 8-year winter maintenance contract. This deal strikes the balance between keeping up on the growing demands for snow clearing in our city while keeping our financial pressures top of mind. Thankfully, our staff have been able to identify some savings without impacting service levels. This contract also ensures that we continue to follow through on our commitment to enhance pedestrian accessibility at bus stops and at priority sidewalks, feedback we've been receiving from residents for quite some time. We will also continue to find savings and apply a need, not a want, lens when negotiating city service contracts moving forward. If we're going to successfully eliminate our deficit due to this crisis in the coming years, we need to tighten our belts. And with that, I will now turn it over to our Chief Medical Officer of Health, Dr. Lawrence Lowe, to provide us with a brief health update. Thank you. Dr. Lowe.
Thank you, Madam Mayor, and good afternoon. As of this morning, Peel Public Health has investigated 2,874 cases of COVID-19 in Mississauga. Of these, 126 are active, 2,524 have recovered, and 224 have sadly succumbed. I know that this year has been hard, and like many of you, I lament the sacrifices that have been made to bring COVID-19 under control. Opportunities, business plans, precious moments and times with loved ones, even simple things like hugs. In spreading from person to person, COVID-19 preys on the relationships that underpin our community. And in the worst cases, some in our community have succumbed to this terrible disease. Our essential workers, healthcare workers, and frontline workers and public health staff have also worked tirelessly. We recall there are truly no winners in a pandemic, and I know this hasn't been easy. But I want you to know that it has been worth it. And where the virus sought to divide us physically, our uniting in purpose has won the day so far. On Monday, the province advised that Peel would remain in Stage 2 for at least another week. I understand the decision and the caution in which it was made. I note that our healthcare, tracing, and testing capacity remain optimal. And in fact, since Friday, July 16th, Peel Public Health has worked with our provincial partners and 3 other health units to launch a new, centralized digital solution that greatly speeds up reporting and contact tracing. This new system is a game changer. It will allow labs to report positive tests to Peel Public Health electronically so that contact tracing can start faster. It is also intended that more data will be available and in real time. During the transition to this new system, I can assure you that Peel's daily cases have remained steady in the neighborhood of 20 to 30 new cases a day, and not the higher totals that have been reported elsewhere. These reporting challenges are temporary as we transition into the new provincial system. For now, numbers for Peel by municipality are available on our website at peelregion.ca/coronavirus. And you will see there that our 7-day moving average of new cases, the measure that we use to mark progress against this disease, continues to decline, particularly here in Mississauga, and the total cases reported by the province and by our agency since July 16th are comparable. Most critically, nearly 90% of the cases that we have here in Peel are linked to known outbreaks, which means we know where the disease is in our community. And so as we approach what I hope will be an announcement to move to Stage 3 in short order, I urge you to remember that there is no secret about what we need to do to beat COVID-19, to live with COVID-19. If you are sick, please get tested and then stay home and self-isolate. Practice physical distancing. Wash your hands frequently and mask in close quarters where it is required. On the topic of masking, let's be kind to each other, particularly for individuals who cannot wear masks or face coverings for whatever reason. There are alternatives such as distancing or serving people differently. And frankly, there has been enough stigma and discrimination throughout this pandemic. We all need to come together and practice the core 4 behaviors every single day. Every business that reopens in this stage or the next also has a part to play in promoting these behaviors. And I thank Mayor Crombie, Mayor Thompson, and Mayor Brown for supporting the recommendations that I have provided around indoor services in restaurants and bars, as well as gyms and fitness centers. Those sectors should take specific care in reopening, but every business that reopens should have a workplace safety plan and implement precautions that keep staff and visitors safe. I also urge businesses to keep track of who is on site through a logbook to inform contact tracing if it should be needed. I know many of you might remain fearful or fatigued, and I want to be clear. Taking these precautions offers us the chance to live our lives while minimizing the risk and stopping transmission in the first instance. Doing this right will keep COVID-19 down and our community open until the ground shifts with a vaccine, cure, or change in the viral picture. This is our 1.4 million person group project in Peel, and we must hold this line together for each other and for our community. Thank you. I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe, as always. I want to touch on another extremely important topic, and one I want to reassure residents that we're not losing sight of during this pandemic, and that is the issue of guns and gangs. Many of you will remember earlier this year, the GTA experienced a rash of gang violence. Innocent lives were lost, including Jonathan Davis from our beloved Malton community. The victims and their families have been left to pick up the pieces and are searching for answers. Yesterday, Peel Police made several arrests in the murders of Jonathan Davis and Giovanni Della Hale. Cases police have determined that are related. These arrests bring Davis and Della Hale families one step closer to receiving closure and the justice that they so rightfully deserve. I want to thank Chief Nish and Peel Police for their efforts to track down these criminals and hold them accountable. We will not tolerate gang violence in our city. Mississauga is a safe city, and we intend to keep it that way. And I am confident that by working together with the community, police, we will identify anyone else that may be involved in these shootings and ensure that they too are brought to justice. Thank you. And now I'm willing to take questions from the media.
Mayor Crombie, your first question comes from Ashley Newport from Mississauga. Ashley, please go ahead.
Hi, Mayor Crombie.
Welcome, Ashley.
So other mayors in the GTA have talked about whether or not, and I know this was discussed at the council meeting, not this week, but last week, about potentially encouraging condos and apartment buildings to make masks mandatory in the common elements, so the lobbies and the elevators. Is this something that you're considering in Mississauga with there being so many condos and apartments? Is this something that residents have been asking you for?
That's a great question, Ashley. In fact, that came up at our council meeting today as well. And I just had that same conversation with Dr. Lowe. And we believe because these are privately run facilities that we don't have the ability to invoke that license in that way to require mandatory masks. But I'm going to pass it over to Dr. Lowe and he can share with you what he knows. Dr. Lowe?
Thank you, Madam Mayor, and thank you, Ashley, for the question. Certainly as was described from a medical perspective, we do know that the wearing of non-medical masks where physical distancing is difficult, which may occur in certain common elements in condominiums and apartments, still remains a strong recommendation from public health. But as the Mayor has identified, I believe that it is up to these individual condominium corporations and apartments, given that they are private property, to take appropriate measures and policies to protect their staff and their residents. So certainly the strong recommendation from public health remains that if you're in an indoor space or in any space where you're unable to physically distance, that you should be wearing a non-medical mask to protect each other. Thanks for the question.
Thank you.
Is there a follow-up, Ashley?
Yes, there is. So today you had mentioned about how, you wrote a letter with other GTHA mayors about additional precautions and public health measures that you'd like implemented with the reopening of bars, indoor dining, gyms, and so forth. In the event the province does not implement any additional public health measures, do you or the region of Peel have the ability to implement measures across Mississauga and across the region, and is this something you would consider?
So the GTHA mayors raised this not only as a concern, but we thought it would be better applied by the province, so it was uniform right across the province, and certainly at least in the GTHA, and that's why we appealed to the Premier. I'm just looking at Dr. Lowe, whether we have the ability to ask those. We don't. We might. Dr. Lowe is saying that he does not believe that he has the authority to invoke that, but perhaps we could. It's a very strong recommendation, as he would say. We would apply pressure to those business owners, the gyms and the bars and the pubs and the clubs, etc. But I will check with our legal departments if the Premier is not willing to invoke those recommendations, whether we have the authority to as mayors within our own city limits.
Your next question comes from Steve Cornwell from the Mississauga News. Steve, please go ahead.
Welcome,
Mayor Crombie, how are you?
Welcome, Steve. I heard your questions yesterday as well at the press conference.
Yeah, that was me. Speaking, I guess it was raised at the press conference yesterday as well, but it seems like there is kind of an announcement on specific funding for municipalities, including Mississauga. It seems like it's imminent. And you said, obviously, the city deficit is $60 million this year. Do you anticipate that the federal and provincial governments will cover that deficit in its entirety? And if not, what's the contingency plan?
So Mississauga has a $107 million deficit, but we found $47 million in savings in mitigating measures, such as a hiring freeze, such as laying off 2,000 people, such as the non-discretionary spending, etc. So we have managed our deficit position down to $60 million, as you have said. The province, the federal government has announced the $19 billion, $7 billion of which will come to cities. Well, yes and no. It will come to COVID activities, so it will also fund testing, tracing, LTCs, long-term care homes, seniors, childcare, etc. And there will be a portion of it for cities as well. And then there will also, in addition, be some subsidy for our transit programs, because our transit in particular, those losses are non-recoverable, and in Mississauga's case, it's about $30 million, $7.5 million per month. So we're very hopeful. We don't know, the ink hasn't dried on those agreements yet, so we don't know how much specifically cities will receive for our operating deficits, but we're very hopeful at this point that we will receive some money, and in particular for our transit deficits.
Thank you. And on a different note, the city has kept, I know there's a discussion today at Council to do about today as well about the community recreation programs and the recovery for that reopening. But the city has kept its libraries, indoor pools, and community centers closed to date and in a limited capacity. Ontario's Stage 2 allows for reopening of those facilities. So can you take us through why the city has kept those facilities closed to date?
So those, I'll ask Dr. Lowe to address this as well. So we have opened the facilities for summer camp. So we do have our recreational centers, our rec centers open to facilitate the camp programs, and they are operating at about 30 to 50% capacity. So we do have more room for young campers should they want to register. Of course, our 7 outdoor pools are also open, but must be registered for swimming in the lanes. And I think that's the answer for now. So those facilities are being used to house our camp programs. And we are in the process of opening our libraries as well. We will be opening them for phase 3.
Mayor Crombie, your last question comes from Ashwarya Duda from The Pointer. Please go ahead.
About a spike in cases after stage 3, like the other cities have seen. And like you said before, 50% of Peel's cases are patients below the age of 40, and opening almost all public spaces, allowing larger gatherings, means more people going out, more parties, more get-togethers. How do you feel about that, and does that potential spike concern you?
Yes, of course. I follow the numbers very closely. So any uptick, any spike concerns me deeply. And I think this is one of the main reasons that the GTHA mayors in unison moved to make face coverings mandatory in all indoor public spaces, and certainly in outdoor spaces where you cannot safely physically distance. So we'll be watching those numbers very closely as we enter phase 3, and I'm hopeful that that could be next week. As you know, our numbers, our new case numbers, are in the single digits, but nonetheless, it only takes 1 or 2 cases for those to spread and the numbers to increase. So I have no reservation about moving back to phase 2 should we need to, but we are cautiously optimistic that people are following rules and guidelines and are wearing their face coverings, whether there are scarves or bandanas or non-surgical masks, when they can't safely physically distance or in indoor public settings. But we continue to watch the numbers very closely every day. It's the first thing we look for.
Thank you. And my follow-up question is...
You may want Dr. Lowe to respond to that as well about the, what measures might be taken should that we see a rise in cases. If I may, I'll ask Dr. Lowe.
Yes, thank you for the question, and thank you, Madam Mayor. I want to be absolutely clear that as we move towards a stage 3 reopening, ultimately the ability to reduce the risk of transmission of COVID-19 is in all of our hands. And so it really is important, and I've certainly said this message a number of times, to continue physically distancing, to continue wearing a non-medical mask where that's not possible or where it is mandated, to wash your hands frequently, and especially if you are sick, to ensure that you are staying home and making sure that you get tested first, and then obviously stay home so that you're not spreading the disease. We need everybody to be doing these 4 core behaviors consistently. We need businesses to support through precautions to ensure that these 4 core behaviors can be taken, and that will be how we actually reduce the risk of transmission. And let me also be clear, there will be spikes that occur, despite our best efforts, and that is where we in public health and with our hospital and healthcare partners are ready to test, trace, isolate, and treat. So it is a matter of keeping vigilant, both on our end, where the transmission occurs, and on everyone else's end to make sure we stop transmission in the first instance. Thank you, and I'll pass it back to Mayor Crombie.
My follow-up question is, do you think we should wait even longer before we proceed to stage 3?
So we've been meeting the metrics. We needed 4 weeks of declining numbers. We need capacity in our healthcare system to conduct increased testing and do contact tracing. We've done over 80,000 tests here in Mississauga through Trillium Health Partners. I know in Brampton the numbers are very high as well for the number of tests that they have conducted. And so we've met the indices that have been set out for us. So I think we're ready. I know Mississauga's and single digits, and one more week we should be in the right place. We do want to move cautiously in a very measured approach. We want to move safely for all our residents. Where we see the uptick in numbers is among young people today, which is very concerning. It was reported yesterday that 57% of all new cases are among people who are 39 and younger, so we're talking to the under 40 crowd. I do realize the weather is nice. You haven't seen your friends in a while, but folks, we're in the middle of a pandemic. You need to continue to be vigilant. Please protect yourself, and if not yourself, do it for your parents and grandparents and people with underlying health conditions that can still contract this virus and become seriously ill or worse.
That was the final question. This concludes today's press conference. On behalf of the Mayor, I want to thank everyone for participating. Have a great day and stay well.
Thank you very much.